New videos every day.
Hello everyone, I'm Dr. Jeff Echols, and today we're lucky enough to have this lovely young lady, Bethany, here with us today. And Bethany is going to be having a bouncing baby boy here in just about another 3 months. So we're all very excited about that. Unfortunately, Bethany's been having a few challenges with her lower back during the pregnancy. Now, lower back pain isn't really anything new to Bethany. Unfortunately, she was in a car accident several years ago. And ever since that time, she's been suffering from lower back pain. And not only the lower back has been hurting, but you've been having pain radiating down into the leg, which is a little bit more serious than just regular lower back pain. Now, when you're pregnant, the weight of the baby being on the forward kind of arches the back a little bit, and it puts more pressure on the vertebra back here. It kind of jams the lower back together. And that's one of the main things I hear about women complaining about when they're pregnant, is that their lower back is hurting. And most mothers are very conscientious, and they're not going to be taking any kind of medication that could be contraindicated while they're pregnant. So they really kind of feel stuck and they don't know what to do. Well, chiropractic can be a really great option for pregnancy. It's good for the mother and it's good for the baby. Anytime you can make the mother happier, the baby's going to be happier, yes?
Yeah.
That's right. So today I'm going to show you how I would go about evaluating her as far as her lower back pain and see what we could do to make some corrections and get you feeling a little bit better and getting the baby feeling a little bit better. Another thing that chiropractic really helps with the pregnancy is that when the pelvis of the woman can be twisted due to poor posture, or maybe sitting crooked all day, or your seat in your car is a little crooked, or in her case, in an automobile accident, which actually could have knocked the pelvis out of alignment. That misalignment of the pelvis is going to create a convoluted pathway for the baby to exit. And we want that baby just like on a slip and slide, right? So we can make labor as short and painless as we possibly can. So when you have a chiropractor adjust the pelvis, it starts to realign that pelvis so that that opening is as wide as it can for the baby. Does that sound appealing to you? Yeah, I would think so. Most of the patients that I've had over the years who've had chiropractic care all the way up through their pregnancy have reported that the delivery was much, much easier with chiropractic care than without it. So today I'm going to show you how I would go about evaluating Bethany and her pelvis to see what we could do to just take some pressure off of it and start her on a step-by-step process to having a real easy, safe delivery. Does that sound good? Mm-hmm. Excellent. So Bethany, I'd like you just to stand nice and tall with your arms down to your side, your head erect. And we're going to be not only looking at her pelvis, but we'll also be looking at her shoulders and her head to look for any other kind of misalignment that she might have. And when I'm looking at Bethany from the back, she's carrying her head tilted quite a bit to the right.
Okay, actually back up. I don't have her head in there. You're talking about her head.
That's not a good thing. You need to sit down again, sweetheart.
I think it's all this extra weight.
Yeah.
Okay, so just back up and restart the whole thing.
Okay.
And then when you go over the shoulders.
Okay, so we've got Bethany here. And Bethany, I want you just to put your feet together for me and then look straight ahead. First of all, I'm going to be looking up here at her skull and how it's on her head. And she's got her head tilted to the right, which could mean she's got some imbalances up here in the neck. So we'll be taking a look at that. Next, we're going to drop down to the shoulders. And when I'm looking at her shoulders, they look fairly level, but she's got this shoulder a little bit high. Now, when a person has a high shoulder, it can mean that there's a curvature here in the upper part of the back. And one of the ways that we can really check that is by looking at the shoulder blades themselves. And her shoulder blades, this one is protruding back as well. So she's got a high left shoulder and it's protruding back a little bit, which can indicate a curvature here, which is going to put some extra stress on this part of the spine. And then finally, we're going to check the pelvis and the hips here. And I go down right on top of the pelvic bone here, on the top of it's called the ilium. And I can see that her right ilium is a lot higher than the left ilium there. So what that has done is it's basically caused this right hip to rock backwards, and it's causing a lot of pressure to be built up along the base of the spine. Now in a minute we're going to put Bethany on the table, and I'm going to show you how we would go about gently realigning this pelvis to take some of that pressure off, remove some of that nerve pain that's going down her leg, and then make it easier for that baby to get out as well. Does that sound good to you? Okay. Okay, so Bethany, I want you to lay here on your side facing me. I'm sure she will be glad to get off her feet and relax for a little bit as well. All right, so we've already determined that the pelvis is kind of torqued and contorted a little bit. So we're going to put her into a position that's safe for the baby. She's not laying on her stomach, she's laying on her side, which is a real good position for her. And then we're going to put her body into a position that will gently reposition that pelvis. And I just need this arm like this. And I want you to give yourself a big hug just like that. You all right there? Very good. And let your hips just really relax here. We're going to kind of stretch them out here. And I'm going to come in here and put a little pressure right in through there. Are you doing okay there? Good. That a girl. Did you feel that release in there?
Yeah.
How'd that feel?
Interesting.
Interesting, yes. Okay. So that's half of the adjustment. Now we're going to turn you over and do the other half. And this other half is the part where you're having the pain down in the leg. So I'm anxious to get that fixed for you. So let's have you roll over on your other side. Let's bring this arm right there, that leg rather. Give yourself a big hug. Hug that baby, all right? Now I'm gonna lean you over a little bit, just like this. There we go. You all right there? Mm-hmm. Little push in there, good. Perfect, one more. Perfect, good. How are you doing down there?
Good.
Excellent, very good. Lay on your back and bring your knees up. That'll take that stress off of that lower back. So that's how I would go about relieving the pressure off of the sciatic nerve and off of the hips and the lower portion of the back for Miss Bethany. Miss Bethany, how did that adjustment feel to you? Did that feel good? Did that give you some relief? Very good. So this is a real safe and effective way of giving a woman relief from lower back pain when she doesn't have access to drugs to help numb that pain out. It's a lot more effective than medication because it actually gets to the root of the cause and it's just not suppressing it. And of course, it goes without saying that it's a lot safer, especially while you're pregnant. You don't want to do anything that's going to drug the baby. So this is the way we would do that. I hope this video has been helpful to a lot of these pregnant women out there who are really suffering and don't know what to do about it. This is a real good way to take care of it. And I wish you the best of luck with your pregnancy. I expect a full report on how you're doing. And we'll be glad to take care of you, until you do have the baby as well. Okay. So if you have any comments or questions, please feel free to give me a call or talk to me through my webpage at www.jeffechols.com.
If you liked this video, we have hundreds of more alternative videos ranging from sexual health to psychology to mind control. So if you liked it, go ahead and click on me to enter the Psychetruth channel.